I'm Michelle Blackwood. I'm a breast cancer surgeon here at Barnabas Health. I'm also the Director of Breast Health and Disease Management. So some of the hardest choices a woman can make is whether to have a mastectomy or a lumpectomy when it comes to the treatment of breast cancer. When you have a lumpectomy, many times you also have to have radiation therapy. Radiation therapy does not make your hair fall out, you don't get sick. It's delivered more as a beam to the breast as an outpatient once a day, Monday through Friday for about 6 weeks. That's the traditional whole breast radiation. Many women who don't want the radiation therapy choose mastectomy. The other reason sometimes people choose mastectomy is because they don't want the fear of recurrence. When you have a lumpectomy and radiation, there's a slight chance of recurrence of breast cancer in the breast. So that chance of recurrence in a woman's lifetime is sometimes usually between 2 and 8%. It doesn't change the overall survival. Survival from breast cancer is usually very good. And yet, women sometimes nowadays have been choosing mastectomy because of that fear of recurrence. The other thing is that sometimes women have to have a mastectomy because either the tumor is too big or there are multiple tumors in the breast. The other reason that women may have to have a mastectomy is because they could have what we call calcifications throughout the breast on their mammogram. And if they have that, it is considered a relative contraindication for a lumpectomy. If a woman desires to keep her breast and has a very large tumor in her breast, but her breast is relatively small, one of the things we can do sometimes is give her chemotherapy first and shrink the tumor down, and sometimes we can do the lumpectomy after this and keep the breast. When I talk to my patients about choosing between lumpectomy and mastectomy, we have very, very in-depth discussions. I need to know a lot about them. Each patient is very different. Each patient has to make this decision with all of the knowledge that we have and all of the information that we have about their life. We can tailor her breast cancer treatment to her lifestyle and where she is in her life and to the appropriate treatment of her breast cancer.